The Committee on Health reported on the province's health department's performance for the last financial year. The Gauteng Health MEC Nomantu Ga-Rankuwa was also present. The public engagement was led by Advocate Ezra Litswalo.
The department accounts to the committee across all their performance indicators, and that is why the committee would have resolved that let's go on the ground to engage with the residents of Gauteng.
Community members came from different areas in Gauteng.
You are hiring thieves because in our township, you want PrEP, you'll get it in the township. You want Panado, you'll get it in the township. We can't afford that. There's a shortage of medication because of that.
If nina ben attend a clinic locally, sishirize banking sonke. The
Gauteng Health Department confirmed that although challenges persist, many strides have been made and improvements were recorded in most healthcare areas. However, over 1 billion rand was not used in the last financial year.
As a department, we allocated 62 billion. Out of the 62 billion that we had as a department, we were able to spend 61.3%, 61 billion of that amount that was allocated, and the breakdown in terms of how that money is being. And Chair, just to correct and clarify the issue, there was an underspent year 1.18 billion.
Community members not pleased about the underspending.
The report was received but not welcomed. I don't think it's a true reflection because right now we are on the ground, we see the day-to-day operations, and what is very worrisome in all the presentation is that they spend less or as much as needed in our clinics and hospitals. So that is a very worrisome factor.
It's a budget, it's a money. That money must supposed to go somewhere in where if there is a challenge in medication. You understand? They must spend it there.
I am not happy about the 1.18 billion under expenditure. And this happens when there is consistent underperformance of child health issues.
Reacting to the criticism linked to the under-expenditure, the Gauteng Health MEC says the money that was not spent came from the department's conditional grant. Gauteng Health spent over 98% of its budget for the last financial year.
That amount of money that was not spent, it was coming from the conditional grant. It's not only one conditional grant that we have, so it's different conditional grants, but when it comes then, it comes as a packet now of over 1 billion, because it's 1.1 billion. But that money we had to apply for it again. It's coming back, it's going to be rolled over to us. We're filling the vacancies as we speak. The file is with the Premier on top of his table again to check if those vacancies are funded in the provincial treasury, then they are going to give us a go-ahead.
Some of the mitigation plans will have been received by the committee who are still interrogating them, but also looking into the modalities for how interventions will be modeled as well as employed, but also test the efficiency. So we're yet to test the efficiency of some of the interventions that the department will have propagated.
Meanwhile, the Gauteng Health Department says more effort is also put in place with the help of sister departments to tackle and prevent the food poisoning incidents at schools in the province. The safety of healthcare workers is another priority point. Patricia Fasaki, SABC News in Pretoria.